this is Dr. Tabany with Indian Trail Animal Hospital. I'm just going to take just a few minutes today to talk about vaccinations in dogs. This is Sookie, Dr. Wolf's dog. She's well protected with her vaccinations, and we want your pets to be too. So there are 4 core vaccines with dog vaccinations, and then there are 2 lifestyle or what we would call non-core vaccinations. I'll run through those, but do know that we treat every patient as an individual at our practice. So while there are standards, there could be some variations depending on your pet's health and their needs. So for the core vaccines, first we've got the distemper parvo. That is a combination vaccine, but distemper and parvo as a part of the combination are the most common diseases and most concerning diseases. Distemper is a neurologic condition that can be quite scary, and parvovirus is a gastrointestinal illness. So distemper parvo is a core vaccine. The frequency of that vaccination changes as the pet ages. In fact, in older pets will sometimes do titer testing for distemper parvo. If they've had multiple throughout their lifetime, they may still be protected even beyond the next 3-year recommendation. The second core vaccine is Bordetella, also known as kennel cough. Common miscommunication and misinformation regarding that vaccine is about the need for it. In fact, every pet does need to be protected for kennel cough, even if they're not boarding, grooming, or around other animals a lot, because we certainly want to avoid any coughing difficulties at night when they contact that, even from sniffing a blade of grass that an animal infected might have had the disease and can transmit just from sniffing leaf to leaf and grass to grass. So Bordetella kennel cough is your second core vaccine. The third core vaccine is rabies, of course, state law. We don't hear about rabies a lot in dogs these days, which is really a blessing, but it is still required and very important. It is interesting to note that the most common way that people and dogs in our area get rabies, and it happens in the county with pets every year, is from bats. And often will be exposed, or pets will be exposed to a bat bite and not even know it. So even though it's not as much of a problem as it used to be, it is still a requirement and an important vaccine protection. The fourth vaccine requirement is leptospirosis. That is a bacteria that can cause liver or kidney disease and is more frequently found in our area because of the construction that's here. The 2 non-core vaccines, again, lifestyle things that we'll discuss with you, are Lyme from tick-borne illness. Remember that Lyme ticks, even the adults, are quite small, and the nymph ticks, the baby Lyme ticks, are so small that they're smaller than a poppy seed. So you would never find them, you wouldn't know if they're present. We'll discuss the importance and particular nature of the need of that vaccine with you at your visit. And then the other one is flu. So a little bit different than human flu. There are 2 types of dog flu. One in particular is more dangerous, but the vaccine contains both of them. If your dog is going to daycare, groom, pet sits with a pet sitter that's going in and out of homes, and those types of situations, then your pet should have flu. If you have questions, we're more than happy to answer them. This is what we do every day, is protect pets, work with individual families so they can do their best for their pets, and we look forward to seeing you at your next visit. Thank you.